So Dr. Kong, welcome to the program.
Thank you for inviting me.
That's great. Well, Dr. Kong, we hear a lot about you doing work in telemedicine in Australia. Can you tell us a little bit about this vis-a-vis glaucoma?
I think telemedicine has never been as forefront in medicine as it is now. And for glaucoma, we've been using a lot of new technology to help us. And it's great time to actually experience some of the new developments. And the main thing is the increased use of telehealth in consultations, using remote monitoring of vision as a way to continue to be able to provide excellent care to our patients while we are experiencing one of the most challenging time in decades.
In my mind, the wealthier demographics of the world might have a choice whether they want to go into a clinic or not, whether they want to use a telehealth procedure or not, given our new coronavirus environment. The poorer demographics of our world probably don't really have a choice. Either they're going to be seen by someone who's going to be able to diagnose them remotely, or they're not going to be seen at all. So I could see how telehealth could apply for both types of populations. But does that make sense to you as well?
I think a lot of the costs of seeing doctors is traveling, and also the problem with COVID-19 is that we really there is a restriction of travel, and so the poorest population live in rural areas, and I think if telehealth is used more widely, you could imagine that you could have multiple sort of remote community health centers that is able to provide that local center with a telehealth terminal, and then you could through the terminal to consult with a specialist in the city area, and I think that will really benefit a lot of rural communities.
Well, and now, given this new era that we're in, would you say, in terms of your own practice, are you finding more need for drops, more need for MIGS type implants, need for something else? What are you finding in your practice?
Something I also want to highlight is the importance. It's becoming increasingly evident to me that the ability to monitor patients' vision remotely is also quite important. For glaucoma, obviously the indices that we rely on to make decisions include eye pressure and visual field changes. Eye pressure, there are some projects that we are trying to do that we've been looking at is whether we could send out an eye care home device to patients to check eye pressure at home. But in terms of vision telehealth, there are actually good systems currently being developed that allows visual field to be monitored in a remote way. And I've been involved in developing a system called Melbourne Rapid Fields, and it's been tested worldwide, and it's been quite important during this COVID-19 time. I had a patient recently who had a blunt trauma to his eye, and he developed a small choroidal rupture with some blood near his macula. I suggest to him that he may need to maybe do a TPA with gas type treatment to push the blood away from the macula. But due to the COVID-19, he didn't want to come, and I was quite concerned about his vision. So I sent a link for him to do a macular 10-2 visual field at home. And he was able to complete the test at home, and as soon as he completes the test, I was able to see that his visual, macro visual field, and sure there was a scotoma sort of near the center of the vision. But it appears to have already self-shifted from the center. So I go, okay, let's watch it. And then 2 weeks later, I send the same link, and the scotoma becomes smaller. And I go, okay, all right, fine. So I will continue to monitor this. And then 3 weeks later, he eventually decided to come back, and luckily, the bleeding actually has self-resolved, and we didn't need to have any sort of surgical treatment. And so it actually provides a way for us to get some information about the patient's vision that we can then make a clinical decision on.
It's fascinating to think about sending a link. We send links all the time for bits and pieces of information, but here to diagnose. And just a final question, telehealth in Australia versus other parts of the world, what do you think are some similarities? What do you think are some differences?
In Australia, because of the vast space between the urban and the rural areas, it is quite critical that we need to use telehealth more to provide the service to our population. And I think the telehealth platforms that is available really needs to, so it has been sort of evolving, and it's at a stage that it's working quite well. In the case of our collaborative care clinic, we are able to have both video conferencing capability and screen sharing capability, and I was able to sort of point out areas in the tests. I can control the mouse remotely and point out areas in the test that is important for the optometrist to focus on. And I think it's useful both as a communication tool, as a teaching tool, and a collaborative tool. So there are various platforms out there that we've been using a platform called Health Direct, which is developed by the Australian, with the support of the Australian government, and that's been working very, very well here.
Dr. Kong, thanks so much for sharing your knowledge in this important field. We look forward to hearing from you again.
Thank you so much, Matt.
All the best.
Thank you for inviting me.